Hello class, today I'm here to talk to you about tuberculosis, which is also known as TB. The National Institute of Health reports that tuberculosis usually affects the lungs, but it is considered a multi-system disease, which means that it can affect other organs besides the lungs. A person's immune system, genetics, and whether the exposure is primary or secondary determine the body's capability to limit or eliminate an effective inoculum. In addition, tuberculosis has a number of factors that make it very difficult for the alveolar macrophages to completely destroy the organism from an infected individual. As a result of the high content of mycolic acid in the bacteria's outer capsule, phagocytosis by alveolar macrophages is difficult. According to NIH, several studies have shown that tuberculosis interferes with the formation of phagolysosomes. Mycobacterium organisms first encounter a host and cause symptoms known as the primary tuberculosis. So there's a latent tuberculosis infection, and then there's the actual tuberculosis disease. People that have the latent tuberculosis have the tuberculosis germs in their body, but they do not show any symptoms, and they cannot spread the disease. This is because the germs are not active. So eventually they could develop the actual tuberculosis disease. So if the doctor can detect that they have the latent tuberculosis, they will most likely try to go ahead and give them the antibiotics so they don't develop the actual tuberculosis disease. And then people with the tuberculosis disease are the ones that have the active germs, which this means they have the active symptoms, and they're also the people that can spread the disease. Only a small percentage will develop active tuberculosis following their first exposure. These cases are referred to as primary progressive tuberculosis. Most people who actually develop tuberculosis disease won't occur until after a long period of latency, which is called secondary tuberculosis. Secondary tuberculosis occurs when latent tuberculosis reactivates. According to News Medical Life Sciences, tuberculosis is transmitted from an infected person to a susceptible person by airborne particles. These particles are called droplet nuclei, and they are the little droplets of water that come out when you cough, sneeze, laugh, shout. It can even happen when you talk. It's just the little water droplets that come out of your mouth, whenever you're doing stuff. These little droplets contain bacteria, and they can remain in the air for up to several hours. Tuberculosis is transmitted through the air, not by touching something that has the bacteria on it. It has to be breathed in. So basically, a person has to inhale the infected droplets. Once someone inhales the droplets, they then travel through the mouth or nasal passages and move into the upper respiratory tract, which then they reach the bronchi, which means that they are in the lungs and the alveoli. According to the CDC, the symptoms for tuberculosis depends on where it's at in the body. The main site for tuberculosis is the lungs. So some of the symptoms for tuberculosis in the lungs include a terrible cough that can last up to 3 weeks, and sometimes people can even cough up blood. Another symptom is chest pains, really bad chest pains, especially with your coughing, and it just makes the chest pains really bad. Some of the general symptoms for tuberculosis include weakness, weight loss, loss of appetite, chills, fever, things like that. The treatments are different for latent tuberculosis and active tuberculosis. With latent tuberculosis, the doctor may give you medication if they think that you are at high risk of developing the active tuberculosis. If they don't think that you're at very high risk, they might not give you the antibiotic until they think you're at a higher risk. The exact drugs and the length of time to take these depend on your age, your health, and your drug resistance, and where the infection is located in the body. According to Mayo Clinic, the most common medications used to treat tuberculosis include isoniazid, rifampin, and ethambutol. These are just some of the few drugs that you can take. Thank you for listening about tuberculosis. I hope you guys have a great day.